We're a network of community-based organizations that is focused on contracting with different types of payors in the healthcare environment. All of our organizations provide a variety of different services, from primary care to behavioral health care to care coordination and harm reduction, social determinants of health. We're doing a lot of different things, and so we're helping the agencies with contracting. An IPA is a network of providers that is coming together around contracting. It's a particular legal structure that allows the organizations to be able to eventually negotiate on rates and hopefully get better rates as a result of that. And then there's also, I think, an opportunity inside of the IPA structure to innovate and create some new services and new things that are not necessarily done from the standard Medicaid menu.
The healthcare industry has changed tremendously in just the last 5 to 10 years, so it feels that there's greater power in numbers, and I think that we can see a greater impact through working as a larger coalition.
I think it's really leveraging the power of one. As an individual organization, we don't have the resources to really negotiate in this really very complex climate. And I think that being a part of the network brings other lived experiences, bring other expertise, bring other resources, and give us a chance to together sort of negotiate for all of our partners.
Many of our clients go to each other's agencies. We don't have clients that are just Harlem United clients. They're also clients at other parts of the New York City social service system, and that's okay.
The opportunity right now, though, is to start to think about how do we operate now as a network, and that takes a different way of. It's a different strategy. It's a different way of thinking. It's a different way of operating, and at the same time, it's more important and more effective for the person who needs the services. So they need our organizations to work together. They need us to be partners with each other, and I think that's the transformation that's underway right now. The complex economic models and value-based payment and those kinds of things, whether or not those work or not, and they end up being the model of the day in 5 years from now, I don't know, but I think that we will end up with a different way of interacting with each other as a network of organizations, and that's transformative, and that's the part that keeps me going every day, knowing that kind of transformation is underway.
I really think that if we can leverage the strengths of our network in the right way and move people through our network in a streamlined, effective way, you'll start to see those savings. You're going to see people improve their health. They're going to be using the healthcare system less. And if we can demonstrate that in a real way, a real cause and effect way, then I think that the healthcare system should support what we're doing. They would still profit, but then you'd have people housed permanently, and you'd have people feeling better and doing better and being, happier, individuals.
One of the great joys is just passing over somebody's keys, for the first time. That is the person that's been homeless and, get their apartment for the first time. And there are countless examples of that. And once you get somebody in a home, you see, there's life changes after that. They can start taking care of their medical needs, their nutritional needs, their family needs, their mental health needs, just by having a place to rest their head and to kind of think through problems. And we see that every day in our organization and across our partner organizations that do a lot of the same work.